Welcome to the Be Fused podcast. My name is Don, and I am your host for today. We're going to be talking about the diet, the gut microbiome, and the disease nexus with Dr. Anthony Marotta. So, welcome.
Hi, Don. Nice to be here. Thank you.
Yeah, thanks so much. So, I guess maybe can you just talk a little bit about, high level what your thoughts are about each one of these, right? So, the diet, the gut microbiome, and the disease nexus.
Well, first to start with, they're all interrelated, obviously. So, the diet, we're starting to see that one of the most powerful ways to change the diversity of the flora that exists within your gut is actually what you do every day, and that's the food that you put into your GI tract, so to speak. So so with that, again, the diet or our food that we consume either can have a positive or negative impact on the gut microbiome.
Mm.
And then as it relates to the disease nexus, the gut brain axis and just the gut as a whole, again, people have coined, the gut as the second brain, you know, so to speak. When we look at it, we're starting to see that obviously, dysregulation or dysbiosis of the bacteria that resides in your gut, coupled with, for example, let's say a leaky gut, situation, actually is a trigger for the onset of many clinical conditions. So again, when you look at it, whether it be cardiovascular disease, diabetes, neurological conditions, autoimmune conditions like fibromyalgia, et cetera, et cetera. A dysregulated or dysbiotic environment within the gut is actually, again, like, a factor that like contributes to the pathogenesis of all these diseases.
Interesting. So, I mean, just because we may have people that are joining us as well that are, listening in on the podcast that might not have, medical background or any of the history that we have, maybe we should talk a little bit about the gut microbiome itself and like, what is that, specifically as well.
Certainly. So, I mean, high level, the microbiome is obviously the flora or the bacteria that reside within our GI tracts, so to speak. And when you look at, you know, the number of like bacterial cells or microbiotic cells that exist within our body, it's almost equal. Like, so we have an equal number of human cells to actually bacteria that reside within our systems.
Wow.
So, we're not just basically, made up of human cells. We have an equivalent number of bacterial cells within our bodies. And I think if I remember correctly, I can't remember how many trillions. I think it's 3 or 4 trillion human cells and 4 trillion bacterial cells.
Wow. Yeah, and so I mean, this microbiome isn't just working on digesting food; it's doing, even more than that. Correct?
Correct. Yeah, we live in synergy with them. So they, again, like they actually can induce certain hormones to be released within the gut. They can actually promote the activation of inflammatory like factors. So they're not just there like, as kind of a resident, population like that's a bystander. They actually contribute to stuff, and we're starting to see, again, clinically, the power of the microbiome through some of the like fecal transplant work that exists, where again, they're transplanting. And I mean, the historic case has always been with C. diff, where they've, obviously used that as a form of treatment for very aggressive, diseases. But now, like, you're starting to see where they're leveraging fecal transplants in other in other clinical conditions. And recently there was actually some interesting work done in melanoma patients where they had a subset of patients that were refractory to treatment, and when they transplanted the the microbiome from responsive patients into non-responsive patients, those non-responsive patients started to respond to therapy.
Amazing.
So it's so the microbiome is doing much more than what we even know today, and obviously it's a very hot area of research as well. I've got to imagine in the future that we'll see more microbiome therapies, hitting the market as well as we learn more about it.
Yeah, and then in the very opening, you were also talking about the gut being seen as the second brain. Can you talk a little bit more about that as well?
Yeah, you know what? Again, too, because of the gut brain axis, so to speak, and just to kind of keep it as a high level, again, the gut itself is so heavily innervated. It actually, again, so when I say innervated, the number of nerves that come into the GI tract, it's actually, the vagus nerve itself, which is one of your cranial nerves, innervates the GI tract quite, intensively. And so there's a big neural network that exists between obviously the gut, and the brain. And, we're starting to learn too. And by no way, am I the specialist with the gut. That's why we have gastroenterologists. But, again, just kind of quoting, them, like there's these finger like projections that actually extend into the lumen of the gut and actually surveil, or almost are like an antenna that surveil what's actually present within the gut to, for example, warn it, as a flight or fight type of response. Because again, we're getting obviously various factors being added into the gut, so to speak, when we consume food, and some of those could be for example, beneficial, and other, factors could be detrimental. So the gut's very smart in policing what's interrogating and policing what's within what's within its environment.
Yeah. Well, and I mean, I think all of us have sort of experienced, whenever you eat something and your gut goes into distress as well, that, sometimes it's just not exactly happy with the food that you've put
No,
in, and so it all of a sudden reacts. So,
yeah,
yeah.
yeah, and it's as a consequence of that innervation that's there, or how heavily involved the nervous system is within the gut as well.
And Hippocrates, also said, let food be thy medicine and medicine be thy food. Um, I guess we're seeing more and more of this exploration. Either, I mean, epigenetics is one area that I know I've seen and heard a lot about, and then, just in general, just the healing properties of food as well. Maybe we can explore that thought, as well.
Sure. I mean, again, let's look at two different conditions: diabetes, manage your sugar, and then, for example, IBS with a low FODMAP diet. And I like the FODMAP example a little bit more, because there's something with a dietary intervention that you can actually obviously improve. You can improve the IBS state with a low FODMAP diet, so to speak. And when we look at what Hippocrates stated, basically, very insightfully, let food be thy medicine, medicine be thy food. That was in a situation where, again, food was very different than what it is today, right? And so, I don't think that Hippocrates was referring to, effectively ultra processed foods, as part of that. And one thing that's happened, probably, you know, I think it became more prolific in the mid to late '80s with fast food and just kind of conveniently packaged food. The whole system started to change where, again, because of our busy lifestyles and the need for convenience, food became needed to be more convenient for the consumer. But with that and consistent, you started to see, like, for example, an evolution of the, let's say, state of mind where, again, we went from producing things like in, let's say, individual kitchens, so to speak, or more regionally into more of a manufactured type of modality. And with that, now we're starting to see the ramifications of more of a manufactured or ultra processed, food ecosystem. There's enough data to substantiate that, again, these ultra processed foods have and poor quality diets have a poor, impact, or a negative impact on people's well-being.
Yeah, and I remember in the town that I grew up in, we had a local, fruit and vegetable stand, right? So I mean, I didn't grow up, with a farm in my backyard. I grew up in Indiana, but there were lots of cornfields. No, there wasn't access to a lot of the other fruits and vegetables, at least where I lived, other than to go to a fruit stand. And then now you look at, okay, so you go to the store today and you have a plethora of places that you could go in the store, and you may think that you're eating healthy, and it's so challenging. I feel
Yeah,
like overall to try and find just the right foods to be able to stay healthy as well.
yeah, yeah. Well, and I think again too, this is an area that requires continual, investigation and observation, right? Like we need to always, again, too, evaluate the data. Nothing is static as it relates to that. And then, on an individual basis, each person is different, right? So we need to appreciate the fact that what might work for you might not work for your neighbor, your partner, or your children, or whomever. It's definitely not a one shoe fits all mentality or modality.
I wish that it were that way. It were a lot easier, overall to choose exactly, you know, what what it is that we eat to feed the things that we need so that we always feel healthy, right? And our skin looks good and we feel energized. And I mean, isn't that what most people would want is, you get that satisfaction out of food, but then you also get the benefit, as well.
Yeah. Yeah. And again, there's, eating in balance is critical. And then, eating more, the one thing that we can all do is eat more whole, real foods as opposed to what we perceive to be like whole or real food.
Can you give examples of those? Because, again, things are popping in my head, but just trying to make sure that they're calibrated appropriately as well.
Yeah. Yeah. Well, I'm curious, like before I give you those, so what's popping into your head? I'll ask you a question back.
Yeah, so I mean, the easy answer for me is whole fruits and vegetables, right? So apples, oranges, grapes, bananas, those sort of things. In addition to like avocados and cucumbers and potatoes and all of those things. The tougher challenge becomes then you start to add in, okay, a certain amount of protein every day. What is the right protein,
Yeah.
in terms of whole foods that you might be eating? And I'm a favorite. I love processed sausages and things like that as well. And so it's one of those things where you've got to find and strike the balance of making sure that you're eating healthy, but also not overindulging in things that could be have a lasting negative impact as well.
Yeah. Yeah. So it's interesting again too, like when we think of it, fruits and vegetables, I like to tell people you should be thinking about vegetables and fruits, like in that order. Firstly, because again, if you look at the bear that goes to hibernate, what do they typically forage on before they go to hibernate? They eat like a lot of berries and different apples, things that, for example, lead to weight gain, right? So for me, fruits are important, but again, they're probably not intended to be consumed to the extent that we're consuming them. I think more vegetables for sure, and then grains, so to speak. As it relates to protein, there's data that exists, and I think most people are shocked, with this. Like, so for example, okay, vary your sources of protein, right? Like number one, but like red meat, and I think you and I have had this conversation before. There's data that exists that tells people that the average consumer should not eat more than 22 grams of red meat per day. meaning that essentially that would equate to less than what effectively uh, you know for the American or for the Canadian people, I guess it would be like 6 to 7 ounces. For I guess someone in the U.S., like what would that translate to? 6 to 7 ounces. Like I'd have to do some math to figure out how many pounds, like that would actually relate to.
Yeah, I mean, I think you still, I mean, like if you were to go out to like a steak restaurant or any place like that, I mean, they still would give you the ounces
Ounce.
most
Okay.
often. Yeah. Yeah, and I mean, just as an example for anybody that's listening in the US, right? A lot of petite steaks. So if you go for, you go out to steakhouse or whatever where they're going to slather your steak in butter and put it on a grill and all that kind of stuff, 9 ounces oftentimes is what you wind up with. So what Dr. Marotta is saying here is that you're already starting with a portion with a petite steak that's one a little bit over sort of what you're talking about as well.
Yeah.
So yeah.
Yeah, and then the other aspect too, again, something that's quite insidious, within our ecosystem is deli meat and processed meat. WHO put out guidance years ago that they basically tried to get people to stop eating it, but again, when you look at the recommended daily like amount, you know, and I think you and I've had this conversation before, but I don't know if you remember or recall, like, what's the suggested, amount of deli meat that people should consume daily.
I don't remember.
So it's 2 grams.
Wow.
So
Wow.
each slice, so again, just kind of thinking of like a slice of deli meat, like typically from our end when we look at it, they're between 20 to 25 grams. So one slice is equivalent to what you should eat, within 10 days. So when you go to the store and you get like, a processed deli meat sandwich, you probably typically shouldn't have another one, for another like 50 days.
Wow.
Just based on that math. Yeah, but the industry, like, and people pick apart certain things. So, okay, yes, red meat, limit your consumption. Deli meat, like, limit your consumption. But again, too, like when I look at it, we're telling people now, eat more plant rich or plant based stuff. But there's some very bad suspects, obviously within that realm as well, of things that people need to avoid. And again, I think it's the processing, again, of food, that is something that we need to be critical of. Anytime you implement like processing, that's where, again, like, you're adding additives and different factors to stabilize it or to give it a certain taste or texture, kind of, feeling or appearance. That's when, again, the food is being, modified, so to speak. And that's where, again, we need to be educating people that, you need to shift your eating habits to less processed.
Yeah. Yeah, and it's I mean all the things that are running through my head are like I mean from maybe middle school on, I can't envision any lunch that I brought from home having just one slice of deli meat ever.
And it's actually quite insidious. You go into like a grocery store, and it doesn't matter like what grocery store you go into too. You could pick like the most like artisanal store, like, and again, like one of my challenges, again, that we've always faced when we're creating food through package, is sourcing of ingredients. Like, where people typically shop, on our end, we can't shop because the products are just, again, ultra processed and full of additives and chemicals. So, and I can taste it. I can tell, like, even from the texture.
Huh. Well,
When you grab a product.
well, it's good. I mean, I think you said before in the other episode, you said 7 years, right? seven
Yeah,
years with Peckish of, tasting non-processed foods and, teaching your palate, hey, look, this is the way this thing's supposed to taste, not,
yeah, yeah,
and I would imagine if I could go backwards in my childhood, because my mom grew up on a farm. I mean, she had very strong sort of beliefs in terms of like how you go and source food and where you get certain things from and what you should be eating. And you know, she passed away, you know, early on in my life. And so unfortunately, you know, I didn't necessarily grow up with that very long, you know, before all of a
Yeah,
sudden I was in the sort of Burger King or McDonald's realm, not to bring up other brands, but, you know, just, you know, where my palate would have learned things
yeah,
as well.
yeah. And you know what, too? Like, who knows what it was like, effectively back then? Like, I think, over the course of years, processing has just kind of come in and like, maybe made things more equitable for the manufacturers, so to speak. But again, it's constantly evolving, and I think if I remember correctly, there's over 2,600 food additives and chemicals that are like cited as being like safe for human consumption.
Wow.
In my opinion, like, looking at it, like, there should be very few. Like, and we have to look at alternate ways of processing, right? Again, so when, case in point, like, because again, on our end, when we produce, like, our volumes again are like at a certain level. And, because of food safety, you have to look at doing things with, manufacturers. And I remember, when they were looking at like taking on our like salad dressing line, they wanted us to like add EDTA and citrate and this and that. And I'm like, no. Well, how are we going to, do this? I'm like, freeze it. And they're looking at me. It's oil. You can't freeze it. I'm like, freeze it. Lo and behold, because again, there's some liquid component other than oil in there. It, yeah, sure, like, it kind of forms like a gel like substance, but it was fine to freeze it. And they were like, oh, they were amazed. It's like, okay, well, great. I just overcame basically an obstacle that you tried to push me down because, again, your people, like your food scientists, say it's got to be one way, right? And I think, on our end, we have to look at alternate ways of actually processing like food for human consumption. So, right now, for example, there's another modality that is newer, to the food scene in high pressure pasteurization. It's a cold pasteurization process, but it's done under pressure, and it actually like works quite well. So we've been talking with some folks like that run the facilities here in British Columbia, Canada, about looking at the possibility. Should we do a study head to head, look at like processed foods versus like conventionally chemically processed versus HPP, and then let's look at like what happens to the biodiversity if you actually put people on like an HPP like diet or a minimally like kind of processed diet. I think we could probably hypothesize that again it would be better for the gut. So I think there's some stuff that we need to do or that are already being done to look at alternate modalities of preservation of food. And when you think of back to the days of farming, right? Like again, they were jarring their own their own products. It was done
Right.
very different.
Yeah, I mean, my mom. I can remember as a kid. I mean, my mom would have cans as she, you know, the end of growing season would end. I mean, she would have,
Yeah,
you know, cans all around the kitchen with different things that we would need through the winter
yep,
that she canned herself and
yep,
you know ready made stuff and
yep.
yeah,
Yeah, you know what? I mean, it's very different. At least you know what's gone into it. You look at like a lot of processed foods, and obviously, again, like they're high in salt, but they're also high in sugar, and they add fructose and just chemicals, and are those the things that we should be eating? And I think kind of coupled with that, again, too, how do we make it more equitable? Because again, too, when you look at like this whole like shift in mindset, again, it needs to be equitable for the farmer, for the manufacturer, for the retailer, and for the consumer, right? And I think that's a big thing. Like, if we could actually make it more accessible, what would be the downstream health benefits? I'm sure like it would lead to, improvements in quality of life. It would obviously reduce like the economic burden in the healthcare sector. I think we need to start like, doing these types of things, like, and evaluating it and getting the data to substantiate it.
Very good. And then in terms of the microbiome and gut health as well, what are things in the current food environment that help our gut health?
Well, let's take a step back beyond food. Stress, like number one, reducing stress, is a critical thing. So, again, thinking of how heavily innervated the gut is, stressors actually, can exacerbate things. So reducing stress, sleeping well, exercising, kind of doing everything that we hear, get lots of rest, drink lots of water, effectively get exercise. Don't be sitting in front of your computer, all the time. Eat properly, effectively. Don't eat subconsciously. Prime your gut basically for food. Chew it. These are all critical things. And then looking at, for example, what you eat. Like if you can't, the simple hard and fast rule is if you can't understand the ingredient, right? That you need a PhD or something to actually like read the label, you got a bit of a problem. And I think you need to look at, because and there's some labeling changes coming, through the works where they're going to put more details, for example, on the front labels, basically to warn, people about what they should and shouldn't be doing. Actually, you've seen it in some Latin countries, but again, you need to look at the back label, right? Like look at the ingredients, look at the nutritional panel, and then look at basically what the brand is telling you. Does it all kind of coalesce together to create a unified story that makes sense to you? Because again, it's very easy to say something's better for you, right? But you need to look at like what you need to lift up the hood and look at what's under the hood, so to speak, in the product.
And I mean, the unfortunate thing is that I do feel like you have to take some personal responsibility for it as well. And it's kind of unfortunate because I feel like, hey, if you go to the store and you kind of stick to the aisles of the store that really should be healthier for you and, less processed foods, there's what I hear you saying as well is that that's not necessarily, going to result in the best thing. You still got to look at the label and understand, overall, what's it going to do to your health.
Yep. Yeah, again too, I think where we see, things migrating to is that each individual is taking more control of their health, right? Like even for example, again, like, the relationship with, the your clinician or your dietitian or like your naturopath or whoever you see, you know, you're in control of that, right? And I think one of the exciting things that I think will happen, like, and you're already seeing it, is the use of wearable devices. Where again now, like you're putting, the control more into the patient's hand. Where again, we'll get to a point where we'll be able to monitor things more routinely with wearable devices. And I think the person needs to be in control of their well-being. It's your body, it's your right. You need to control what you do. And I think, again, you need to know where to get your quote unquote, information from.
Yeah,
Like,
you and I've had this conversation as well. I mean, I wear the one bracelet that's on my right arm because of it tracks sleep better than my Apple Watch does.
yeah, yeah,
So for that reason, I charge my Apple Watch and I wear something else for just continual activity and sleep monitoring and things like that because I'm somebody that gets into these rhythms where I'm not resting enough. I'm continually thinking about things that are happening, in podcasts or, in my daily consulting life. And those things, keep me awake. And so, it's nice to have something that occasionally will say, hey, wait a minute, we've noticed, continually over the last 3 days, you're not sleeping enough. You need to,
yeah,
spend a little bit more time resting as well.
yeah, yeah. And again, those kind of early like triggers, like, again, you might not be, aware of it subconsciously, right? And those alerts basically from your device will make it more, prevalent to you or apparent to you that you need to, course correct, so to speak.
Yeah.
And I think this is the future state, like, of of medicine, where it's going to become more of a digital transformation where, again, you're putting the tools in the hand of the individual, and then, it's a different interaction with your primary care physician or your specialist, so to speak, or even your, again, your dietitian or your life coach.
Right. Yeah. And I think, I mean, I just, for me personally, it's nice to have those moments where, there is a guardrail somewhere.
Yeah.
Because oftentimes I will test the limits of, can I go this far or not? And, whether it's exercise, I love to intently exercise and, just, really spend a lot of time at the gym and, feel like I've done a lot. But at the same time, is my body in between those exercise moments or even meditation moments or whatever, is my body getting what it needs or not? And I don't think I'm always the best gauge of that. It's having a device remind me that, hey, you honestly need a little bit more rest before you head to the gym again, because you just went and were crazy for an hour and a half.
Yeah. Yeah.
So yeah.
Yeah, no, absolutely. And again, I think that's the beauty of technology. It will help us optimize our health, and possibly hack it too.
Right. Yeah, I look forward to those days. What about things that are our current food environment hurts our gut health?
Very simply put, processed foods,
Okay. Well, that was
right?
a quick and easy answer.
Well, and again, the one thing that we need to be mindful of there, though, is that again, everyone is uniquely different. So, like, even categorically within the whole processed food realm, like, there's things, for example, that might, like, be okay for people to consume, but if you have an ailment, what might work for one person might not necessarily work for, the other person, right? And so, I think the case in point there is when you look at the dietary, routines of, like, a colitis like patient. So someone with, like, Crohn's versus colitis, the diets are slightly different, even though it's a GI related, obviously, issue.
Yeah. Yeah, definitely. If I mean, for sure, anybody that has a known ailment should be working with their physician as well in terms of, any sort of major dietary changes, because you might wind up triggering something,
Yeah.
as well that wasn't intended.
Well, and that's the thing. Actually, it's really important to work with the right healthcare professional, right?
Hmm.
Whether, again, it's a dietitian or a nutritionist. Obviously, the dietitian is probably, the most well versed, like, from an education standpoint. And then, because again, you got to look at the training, right? They're like specialists. Dietitians are specialists within, like, certain clinical areas. Then you have, like, nutritionists, you have holistic nutritionists, you have life coaches. Like, at the end of the day, like, you want to be working with, obviously, the right person. And just because someone looks a certain way, right, like, that they're fit, doesn't necessarily mean that they're qualified to give you, like, health advice, and dietary advice.
Yeah. Yeah, especially, I mean, to go back to the thing that you said earlier, right? That we are all different. And just because somebody found something that works well for them doesn't necessarily mean that they understand everybody in
Yeah.
totality either. So,
Well, and you know that clinically, like, again, too, like, each patient is different. And, again, sometimes, with certain ailments, right? Like, or within, like, a particular disease, again, you know, you can broadly categorize them. But again, like, the pathogenic or molecular root that gave rise to that disease may differ. And with that, then the corresponding treatment regime will differ, as well.
yeah, absolutely. Well, Dr. Anthony Marotta, thank you so much for joining me again on BFuse podcast. I greatly appreciate your being here and providing all this great information. Thanks so much.
My pleasure, Don. Thank you very much. Have a great afternoon.
You too.